Imagine this. You're sitting in your doctor's waiting room, expecting a routine checkup. But did you know that 60% of medical tests performed on people over 70 may lead to unnecessary stress, procedures, or even harm, according to a 2023 study from Harvard Medical School? That's right. Tests meant to keep you healthy could actually steal your peace of mind and vitality. In today's video, we're diving deep into 5 medical screenings you should think twice about after 70. We'll break down why these tests often do more harm than good, backed by studies, real-life stories, and expert insights. Plus, we'll share smarter, safer ways to stay healthy in your golden years. If you find this valuable, give us a thumbs up, share with someone who needs to hear it, and hit that subscribe button to join the Ageless Living community. Let's get started. The hidden dangers of routine checkups after 70. Why routine tests can backfire. As we age, our bodies change in ways that make routine medical tests less reliable and, in some cases, outright risky. After 70, your metabolism slows, organs become more sensitive, and hormonal shifts alter how your body responds to medical interventions. What worked at 50, a blood panel, a scan, or a biopsy, might not be as harmless at 75. The medical industry loves data, measuring, scanning, and diagnosing in the name of catching diseases early. But here's the catch. For seniors, this obsession with early detection often leads to overdiagnosis, finding abnormalities that would never cause harm but trigger a cascade of invasive procedures, stress, and complications. Studies, like one from the Journal of the American Medical Association, JAMA, in 2022, show that overdiagnosis affects up to 40% of seniors undergoing routine screenings. These tests can turn a healthy, vibrant person into a patient overnight, burdened with worry and unnecessary treatments. For example, consider Jane, a 72-year-old retiree who went for a routine checkup. A scan flagged a tiny lung nodule, leading to a biopsy, anesthesia complications, and weeks of anxiety, only to find it was benign. Stories like Jane's are far too common, and they highlight a critical question. Are we testing to stay healthy, or are we testing ourselves into sickness? The pressure to check everything comes from a mix of outdated medical guidelines, doctors' fear of missing something, and society's blind faith in technology. But as we'll explore, not every test is your friend after 70. Let's dive into the 5 screenings you should approach with caution and why they might do more harm than good. 1. Mammography, a double-edged sword for women over 70. The promise versus the reality. For decades, women have been told, "Get your mammogram, it saves lives." And for women aged 50 to 69, that's often true. Mammograms can catch aggressive breast cancers early, improving survival rates by up to 20%, according to the American Cancer Society. But after 70, the equation changes. Why? Breast cancer in older women tends to grow slowly, often never causing symptoms or impacting quality of life. Yet, mammograms don't distinguish between harmless and aggressive tumors. Every shadow on the X-ray triggers a chain reaction. More tests, biopsies, even surgeries, all for something that might never have mattered. A 2021 study from the University of California found that women over 70 who underwent regular mammograms didn't live longer than those who skipped them. However, they faced a 30% higher rate of unnecessary procedures, like biopsies, which carry risks such as infection, slow wound healing, and anesthesia complications. For older women, whose bodies recover more slowly, these interventions can be physically and emotionally draining. The risks of overdiagnosis and overtreatment. Picture this. Mary, a 74-year-old grandmother, goes for her annual mammogram. The scan shows a small abnormality. Her doctor, erring on the side of caution, orders a biopsy. The procedure requires anesthesia, which stresses her heart. The result? A benign cyst. But the weeks of waiting, the pain, and the fear of cancer leave Mary anxious and exhausted. This scenario, known as overtreatment, is shockingly common. The same study showed that 1 in 3 women over 70 who get mammograms face unnecessary interventions. Then there's the radiation risk. A single mammogram exposes you to low levels of radiation, but repeated screenings over years can accumulate, potentially damaging sensitive tissues in older bodies. For women with no family history of breast cancer or genetic predispositions, like BRCA mutations, the risks often outweigh the benefits. When to say no, and when to say yes. So, should you skip mammograms entirely? Not necessarily. If you have a strong family history of breast cancer or specific risk factors, mammograms might still be useful. But for the average woman over 70, the evidence suggests pausing and asking, "Do I need this?" Discuss with your doctor whether your personal health profile justifies the test. If you're healthy and symptom-free, you might be better off trusting your body and avoiding the stress of routine screenings. 2. Colonoscopy, a risky routine after 75. The gold standard that loses its shine. Colonoscopies are hailed as the gold standard for colorectal cancer screening, and for good reason. Between ages 50 and 65, they reduce colorectal cancer deaths by up to 50%, per the National Cancer Institute. But after 75, the benefits diminish, and the risks skyrocket. Why? The procedure itself, sedation, bowel prep, and a scope navigating your colon, isn't trivial. For older adults with fragile tissues, weaker hearts, or underlying conditions, complications like bleeding, bowel perforation, or circulatory collapse are real threats. A 2023 Harvard Medical School study found that people over 75 face a 7-fold higher risk of serious complications from colonoscopies compared to younger patients. Yet, many doctors still recommend them as a routine precaution. Why? Old guidelines and a better safe than sorry mentality. But here's the kicker. Colorectal cancers in older adults often grow so slowly that they're unlikely to cause harm in your lifetime. A real-life example. Take John, a 76-year-old who felt fine but went for a routine colonoscopy because it's what you do. The prep left him dehydrated, and during the procedure, a small tear in his colon led to emergency surgery. Months later, he's still recovering, grappling with infections and a weakened body, all for a polyp that was unlikely to become cancerous. Stories like John's highlight the need to weigh risks carefully. Safer alternatives. Instead of routine colonoscopies, consider less invasive options like the immunochemical fecal occult blood test, IFOBT. It's a simple at-home test that detects blood in the stool, a potential sign of cancer, without the risks of sedation or invasive procedures. While it's less precise, it's far gentler and can provide enough information to guide next steps. If you're healthy, active, and symptom-free, talk to your doctor about whether a colonoscopy is truly necessary or if a less risky approach makes sense. 3. PSA testing, a prostate problem for men over 70. The misleading blood test. For men over 60, the PSA, prostate-specific antigen, test is often a reflex, a quick blood draw to check for prostate cancer. But this test is a wolf in sheep's clothing. Elevated PSA levels can signal cancer, but they're also triggered by benign conditions like an enlarged prostate, inflammation, or even recent physical activity like cycling. According to the U.S. Preventive Services Task Force, USPSTF, 70% of prostate cancers found in men over 70 are slow-growing and unlikely to cause harm. Yet, a high PSA result often leads to biopsies, surgeries, or radiation, treatments with serious side effects like incontinence, erectile dysfunction, and chronic pain. The domino effect of a single test. Consider Tom, a 73-year-old who got a routine PSA test. His slightly elevated result led to a biopsy, which caused an infection. The biopsy found a small, non-aggressive tumor, but under pressure, Tom opted for surgery. The result? Incontinence and a loss of confidence that changed his quality of life. Had he skipped the test, he might still be enjoying his daily walks without worry. Making an informed choice. The USPSTF has warned since 2018 that PSA testing in men over 70 often leads to overdiagnosis and overtreatment. If you're symptom-free, no trouble urinating, no pelvic pain, no blood in your urine, you might not need this test. If you're considering it, ask your doctor about alternatives like free PSA testing, elastography, or MRI, which provide more context without jumping to invasive procedures. The key is to prioritize your quality of life over a number on a lab report. 4. CT and MRI scans. Seeing too much, helping too little. The allure of high-tech imaging. CT, computed tomography, and MRI, magnetic resonance imaging, scans are the darlings of modern medicine. Precise, high-tech, and seemingly foolproof. But for seniors, they're often a Pandora's box. A single CT scan exposes you to the radiation equivalent of 200 chest X-rays, per the National Institutes of Health. For older adults, whose cells are more vulnerable, this increases the risk of DNA damage and inflammation. MRIs, while radiation-free, often use contrast dyes that can stress aging kidneys. The bigger issue. These scans frequently pick up incidentalomas, harmless cysts, scars, or tiny abnormalities that lead to a spiral of follow-up tests. A 2022 study in JAMA Internal Medicine found that 30% of imaging tests in people over 70 result in unnecessary procedures, from biopsies to surgeries, with real physical and emotional tolls. A cautionary tale. Sarah, a 71-year-old, went to her doctor for mild back pain. Just to be safe, CT scan revealed a small kidney cyst. This led to a biopsy, which caused bleeding and weeks of recovery. All for a cyst that was benign and would never have caused problems. The stress and physical toll left Sarah questioning her trust in routine scans. A smarter approach. Before agreeing to a CT or MRI, ask, is this test necessary for my specific symptoms? Often, a thorough physical exam, ultrasound, or simply monitoring symptoms is enough. Save high-tech imaging for clear red flags, like sudden severe pain or neurological symptoms, and avoid the trap of scanning just in case. 5. Routine blood tests. Numbers that mislead. The illusion of control. Annual blood tests, checking cholesterol, blood sugar, liver, and kidney function, are a ritual for many seniors. They feel like a safety net, a way to catch problems early. But here's the truth. These tests often provide a false sense of security. A 2023 Oxford University study found that 42% of routine blood tests in people over 70 lead to unnecessary treatments, often with medications that cause more side effects than benefits. Why? Blood values fluctuate naturally due to stress, diet, or even a bad night's sleep. More critically, standard reference ranges are designed for younger adults, not seniors. A slightly off liver enzyme or thyroid level might be perfectly normal for a 75-year-old, but triggers a cascade of follow-ups, medications, and worry. The emotional cost. Imagine getting a call from your doctor, your cholesterol is a bit high, let's start statins. Suddenly, you're on a medication that causes muscle pain and fatigue, all for a number that might not mean anything in your context. Routine blood tests can also miss serious conditions like cancer or heart disease, which often show normal results in early stages, lulling you into a false sense of health. A better way. Instead of blanket blood panels, request targeted tests based on symptoms. For example, check vitamin D if you're fatigued, or inflammation markers if you have joint pain. Insist on age-adjusted interpretations, and don't let a single abnormal result derail your peace of mind. Trust your body's signals over a lab report. The psychological toll of overtesting. The anxiety trap. Medical tests don't just affect your body, they hit your mind hard. Every borderline result or "let's keep an eye on it" comment plants a seed of doubt. For seniors, who may already feel vulnerable as friends fall ill or mortality looms closer, this can spiral into medically induced anxiety. A 2024 University of Basel study found that seniors undergoing frequent screenings were 25% more likely to develop depressive symptoms than those who trusted their bodies and sought care only for clear symptoms. Picture this: you notice occasional dizziness. Instead of brushing it off as a normal part of aging, you're sent for a battery of tests. Each vague result, it could be something, fuels sleepless nights and a nagging fear that something's terribly wrong. Over time, this constant alertness weakens your immune system, raises blood pressure, and can even lead to social withdrawal or depression. Breaking the cycle. The antidote. Trust yourself. Not every ache or forgotten name is a red flag. Learn to distinguish normal aging from true warning signs, like sudden weight loss or persistent pain. Say no to tests that feel unnecessary, and seek doctors who listen to your concerns, not just your lab results. Smarter alternatives for healthy aging. So, if these tests aren't the answer, what is? Here are 3 evidence-based ways to protect your health after 70 without the risks of overtesting. 1. Functional self-observation. Forget lab numbers. Your body's daily signals are often better indicators of health. Studies, like one from the Journal of Gerontology, 2023, show that declining grip strength or slower walking speed predict aging-related issues more accurately than blood tests. Pay attention to how you feel. Are you steady on your feet? Is your energy consistent? These observations are free, non-invasive, and empower you to act early without medical overreach. 2. Meaningful health conversations. A 15-minute chat with a thoughtful doctor can reveal more than a dozen scans. Discuss your sleep, diet, mood, and energy levels. A skilled physician can spot red flags through listening, not just machines. For example, a 2022 study in The Lancet found that thorough patient interviews caught 80% of health issues missed by routine screenings. Find a doctor who values your story over your chart. 3. The Holy Trinity: movement, nutrition, connection. The best prevention isn't in a clinic, it's in your daily life. Just 20 minutes of daily walking cuts your risk of heart attack, stroke, and dementia by up to 30%, per the CDC. A colorful, anti-inflammatory diet, think veggies, healthy fats, and minimal sugar, heals more than most pills. And don't underestimate social bonds. Laughter, touch, and community boost your immune system and add years to your life, according to a 2023 Yale study. These strategies are low-cost, low-risk, and proven to keep you thriving without stepping foot in a scanning machine. You've just uncovered a truth that many shy away from. Not every medical test is your ally after 70. Mammograms, colonoscopies, PSA tests, CT/MRI scans, and routine blood work can sometimes do more harm than good, pulling you into a cycle of fear, overdiagnosis, and overtreatment. But you're not a statistic or a lab result. You're a person with wisdom, experience, and the power to make informed choices. Armed with this knowledge, you can ask tough questions, say no when it feels right, and focus on what truly keeps you healthy. Listening to your body, building meaningful connections, and living with intention. Aging isn't about dodging every risk. It's about embracing the freedom to live on your terms, with confidence and clarity. If this video opened your eyes, hit that like button, share it with someone who needs to hear it, and subscribe to Ageless Living for more insights on thriving in your golden years. Let's keep the conversation going. Comment below with your thoughts or experiences. Here's to aging fearlessly and wisely.